recent interest of mine, actually, probably in the last 4 years or so. I've been out of residency for 8 years, and it wasn't until I was just on the internet looking at something totally unrelated and fell down one of those rabbit holes and stumbled upon implicit bias and just read all I could read. It just grabbed my attention for some reason. And, one of the major things I read was, everybody has implicit bias. We all have it, right? And that's so true and definitely important. But that's not really what got me. What got me was not the fact that everybody has implicit bias, is that I have implicit bias that are for sure impacting the care that I hope to provide for my patients. And as a physician, you take that oath, you are the kind of person who wants to do right by your patients. And you can know all the medicine in the world, but you can still have implicit bias kind of infiltrate that patient care and in a negative way, right? And so that really stood out to me. And so I wanted to learn all about it so I could do the best I could to give my patients the best care. And I'm in academics, I'm as much of a teacher as I am a physician. I decided, hey, let me start teaching about this. I teach my residents and students how to treat heart failure. I can teach them about implicit bias. And so I developed a workshop, and, fast forward 4 years later, I've done it literally over 100 times. I've done it all over the world. And I found that I can probably impact a patient's care by teaching about implicit bias probably more than I can by teaching my students and residents how to actually practice medicine. And that was just profound for me. So that's a little bit about how I got here. I'm going to share my screen. This is a talk that I want you all to feel comfortable in, either entering something in the chat or unmuting yourself and speaking at any time. I think it actually helps with the flow of the session. And so there are going to be some times where I ask you some questions. Feel free to unmute yourself and answer, or just type the answer in the chat. And you'll see why that's going to be important here in a little bit. So I hope I can encourage you all to be interactive. There's 43 people on here, so I'm sure there'll be a few all-stars that'll be brave enough to speak up and speak out. So I'm going to share my screen. Okay, y'all got me? All right, perfect. Okay, so let's get into it. So another, random internet jewel that I found that I wasn't looking for is this cartoon. And when I first saw it, it took me back to childhood, and it reminded me of when my older brother and I shared a room, and my mom would come in, she'd yell at us and tell us to clean our rooms up. And we would do that. We would throw everything in the closet, we'd throw everything under the bed. And we truly believed that if we couldn't see the mess was no longer there. It also reminds me of how society has approached these very difficult conversations, right? It has been swept under the rug for years and years and decades and centuries. And it is now, probably more than any time in our history, people are beginning to be brave enough to peel the rug back to see what lies beneath. And it is not an easy thing to do, right? Signing up to sit in on a session like this is not an easy thing to do, because these are difficult things to face, right? They're difficult things to talk about. And I always feel like it's important for me to commend everyone who are willing to have these difficult conversations, right? So this is what we're doing, right? When we have these conversations, when we have institutions that put programs together like this, we are, again, kind of getting rid of this broom, and we are starting to peel back these rugs to face the difficult things that lie beneath. All right. I'm super simple-minded, and so my goals are going to be very simple here, right? We're going to define and discuss implicit bias. When you walk out of here today, you're going to have a better understanding of implicit bias. Simple. We're going to recognize and discuss some of the societal impacts of implicit bias. We're going to understand the impact of implicit bias through shared experience, which means, you all are going to be thinking about stories. Maybe we'll have time to share some. I'll surely share some of my own encounters and implicit bias stories. And then ultimately, we'll have a little bit of time to just kind of quickly introduce things that we know that can kind of help mitigate implicit bias. And I use mitigate very purposefully, because I am not naive enough to believe that we can get rid of implicit bias altogether. I just don't think it's possible. But we can learn methods and take steps to mitigate implicit bias and hopefully decrease its impact. So that's our charge today. That's what we're going to try to do. Okay, so I always like to start out with something like this. And with a lot of things today, you're going to pay attention to the very first thing that your brain tells you, right? Those automatic assumptions that your brain kind of passes to your conscious self, right? And one of the first few things you're going to notice is that there's some horizontal lines on this page, green, blue, red, and then there's some circles or spheres that are what appear to be 3 different colors, right? That's what your brain tells you when you first see it. Right? But if we zoom in a bit and look at it a little closer, maybe we actually see that these circles or these spheres are actually the same. They're the same color. And most of you don't know me. I see a handful of people that know me. You're going to have to trust me when I say these are actually the exact same color. Okay. And try to come to terms with that. Whatever you need to do to convince yourself that these are the same color, do it. All right. And now we're going to zoom back out. And although you know that these spheres are the exact same color, does it make it any easier to convince your brain of such? It doesn't, right? And this is kind of how implicit bias works, because there are going to be a lot of times where it is easier to convince your brains of something that is not true than it is to convince your brains of something that is true. And it really takes a concerted effort to really start to learn how to manage these associations and these stereotypes and attitudes and find ways to not act upon them when they're not true. So that's what we're going to talk about today. So whenever you think about implicit bias, you can think about this optical illusion, which is all it is. It's just an optical illusion. Just some little nuances here. Implicit bias goes by several different names. One that you hear a lot, maybe even more than implicit bias, is the term unconscious bias. I just happen to use implicit bias. I don't know why. It's just what I say more often than not. Unconscious bias is the exact same thing. And for the fancy people, implicit social cognition is also a similar term, which I tend to not use, but I think it means more or less the same. And what it is when we have these attitudes or these stereotypes that affect our understanding, actions, and decisions in an unconscious manner. And really, unconscious should be bolded, highlighted, and underlined, because that's the meat of this, right? That's why it's an issue. And it's also why it's difficult for people to come to terms with it, because it's activated involuntarily and the intent is not there. So when we tell someone there's something within you that you don't know is there that can affect your actions and your decisions in an unconscious manner, it creates some discomfort or cognitive dissonance, right? If you remember psychology, cognitive dissonance happens when your intentions and your actions don't line up, right? They're out of sync a little bit. And so this whole discussion of implicit bias, when we tell someone their intentions don't always result in the same kind of action, it makes them uncomfortable because they are in dissonance, right? So you can do some things to get out of that discomfort. One way to do it is just reject the whole idea of implicit bias altogether, say it's BS, I don't buy into it. Guess what? You have convinced yourself that your intentions and your actions always line up, and you feel better, and you can probably sleep a little bit better at night. That's probably the easy way out. I'm going to challenge you to do it the other way, to assume that, okay, this guy may know what he's talking about, or I've read a little bit, I believe in implicit bias. And there are times when my intentions and my actions don't line up. Now, what can we do to make sure that our intentions and our actions better line up? And when we're able to do that, guess what? We get out of dissonance somewhat. We feel a little bit better. We're able to sleep at night, right? And we didn't take the easy way out. Other things that are important to know is that this is a difficult conversation to have. And I will not ever stand in front of all of you virtually in this case and tell you, oh, this is easy. We can have this conversation. Just get over it, right? I'm not. I will never say that. I would say that, yes, it is a very difficult conversation. And despite me doing this many, many times, it is always difficult to have these conversations, especially with strangers, right? Or colleagues even. So it's worth acknowledging. The other thing that needs to be mentioned is it's not just about race. Race tends to dominate these conversations, and I'm okay with that. I think there are reasons why it tends to dominate these conversations, and we'll talk more about race than anything else during this session. But we also need to acknowledge that there are other groups in society that are at a disadvantage because of all of our collective biases, and we need to acknowledge those groups as well. And then look, hey, if you only hear one thing that I say today, it's this third bullet point, okay? It's the fact that implicit bias is not the same thing as explicit racism, sexism, ageism, or any other form of explicit discrimination or bigotry. I don't want you all to hear that everybody is a racist or a sexist or bigot. That's not what I'm saying. I'm saying we all have implicit bias, but these are two very independent things, and I think that's important. Equally important is for me to say, although they are very different things, for those in society who really bear the collective burden of all of our biases, the intentions are independent of the outcome. So it doesn't really matter to them that implicit bias is not these very same explicit forms of discrimination. The impact is just as bad for some. And so I can't say the first part without also acknowledging that for some people it doesn't really matter because they are at a disadvantage because of implicit bias. Does that make sense? All right, this is where I need y'all. I'm gonna ask you all to either be ready to unmute yourself and yell out some answers, or just type in the chat box. Either one works well for me, okay? So before we get to that point, I need you to clear your minds. I need you to not think about the other sessions you had today or what you're gonna eat for dinner or all of the snow that's gonna fall upon us in a few hours. I want your mind to be a blank slate. And then I'm gonna prompt you with some questions. And I want you to be able to capture those very first thoughts that come to your mind, okay? That's the easy part. The hard part is being willing to share those very first thoughts that come to your mind by either unmuting and yelling them out or typing it in the chat box, okay? All right, so clear those minds. We're gonna warm you up with just a very simple little practice session, all right? Here we go. Okay, tell me what's going on in this picture. I assume there's just a lag.
Looks like a woman on a run.
Yeah, right. A lady on a run. Yes, thank you. Thank you both, Carson and Ahmed, right, and Ben. So we've got a lady on the run, and you knew that before I even asked the question, right? You saw the picture, your brain recognized that based on pattern recognition and past experiences. Hey, this is a lady on a run, okay? So humor me. Also tell me why you knew that this lady was going on a run.
She's wearing fitness clothes.
Yeah. So one, she's dressed for the part, right? It fits our pattern of what someone wears when they go for a run. A couple people, William, Diana mentioned the location, right? She's on a track. And that also fits the pattern of what we recognize as someone who's on a run. And literally, Carly mentions, and Hala mentions, she's literally running, right? She is striding. We can see all of that, right? So simple stuff, right? It's automatic, right? So what we're going to do now, that was great. I appreciate the help here. So keep that same energy for the next part. Okay, so now what we're going to do is we're going to change locations. Okay, so she is no longer at the track. She is now in this neighborhood. This could be for the Oklahoma City people, maybe Nichols Hills. I've heard about it, never been there. I assume they have some houses like this, or Tulsa people, Philbrook area, right? It just happens to be random internet mansion, but you get the point, right? So she is no longer on the track. She is taking a leisurely jog through this neighborhood, okay? And excuse my Photoshop skills, but this is all I can give you, all right? So use your imagination. So she is now running through this neighborhood, okay? What I want you to do as you clear your mind again, I want you to tell me, if you were pressed, what do you think you know about this lady? If you had to guess, what would you say about this lady in her life?
Wealthy.
Wealthy, right? And so as Bailey mentioned, and what almost always comes up first is something that gets at the point that she looks like she belongs in that situation, right? Someone else mentioned it as well, Indigo and Kinsey, wealthy, affluence, right? The first thing that comes is she does not look out of place, right? She fits maybe some of our associations with someone who is in this neighborhood for whatever reason and looks to belong. Great, thank you. What else? She looks educated. Again, she's in this neighborhood. She looks like she maybe fits there. She's young, relatively attractive. She's white. All of that may fit our association of what an educated person looks like. Sure. What else? She feels safe. Yeah, right. Both of you are getting at that, right? She feels safe enough to run in this neighborhood, right? She probably doesn't have to worry about people peeping through the blinds at her. She probably doesn't have to worry about police pulling her over, right? Sure. What else? Let's get detailed. These are general things, but if you had to be pressed on some details, give me some juicy details about this. Like, humor me.
I would feel like if I was also out in that neighborhood and ran into her, I'm immediately kind of on my guard. I'm kind of trying to stay away, you know.
I 100% understand that, right? So you may have some assumptions about her maybe being uncomfortable around you, right? Fair. Okay, so I don't see a picture, but it's Indigo, a guy or a girl? Indigo DeBerry. I'm gonna guess a female because I could be wrong, but this comes up every single time though. So the comment here is she's a stay-at-home mom, and of the 100 plus times I've done this, that comment has come up every single time, and only once was a guy brave enough to say she's a stay-at-home mom. And every other time the comment came from someone who was a female who worked outside of the home, right? So despite a female who works outside the home being that, they still may harbor some associations of what a stay-at-home mom looks like. Does that make sense? But as a guy, I am proud of you. That is amazing. That's just two of over 2,000 people that have done this. Because we all have thought it, right? But you were one of few guys that was brave enough to say that. I wonder if you're married, if you're that brave to step up. I applaud you. So the best one that I ever heard, as we move on to the next exercise, is that she looks like someone who loves brunch. And I see people laughing, right? Because we don't really know what that means, but we know what that means, right? We can understand why whoever it was that said that a couple years ago said it, right? So I always think that's a laugh because we associate maybe the lady looks like this as being a bruncher, right? No big deal. So now what we're going to do is we're going to change the character, right? So we're going to go from her to homeboy here, all right? And homeboy here is going for a leisurely jog in the very same neighborhood as she was, all right? What comes to your minds now? You could be brutally honest.
I would say like the fact that the lady looked like she was like healthy, like a health fitness person. Yeah. So I was more willing to like entertain that she was like a runner, but this guy just doesn't look as healthy. So I don't really buy that he's on a run as easily as I would for her.
Yeah, he doesn't technically fit the pattern of someone we would say is out for a run. And then there's about 12 responses in the chat that all get at one point. He doesn't look like he fits. He doesn't look to belong, right? Contrasted with what we got from the young lady, right? So a lot of things come up. Sometimes I hear, he's, running from something, not going for a run. Some people say he's somebody's son living in the basement. But, all of this stuff is important because, hey, yeah, I pressed you all and asked you and I'm forced you to make some of these assumptions. But think about how many times you do it every single day when you pass a stranger, right? With less information than I gave you in some instances, right? We form these associations and these conclusions all the time, right? And most of the time when we do it, we don't necessarily have enough information to be so secure in our thoughts as we tend to be. So just keep that in mind. So the whole idea of implicit bias kind of is anchored by this idea of mental association. Another way of referring to it is mental. And what it is when there is mental association or mental glue, it allows these tasks and decisions to be made with less effort. The absence of it leads to increased mental effort to complete tasks and make decisions, right? And if that doesn't make sense, it will here shortly, right? So speaking of associations, there are two main things in this picture that have strong associations. And these associations are actually pretty universal across cultures, right? We got flowers. When the weather's nice, the flowers are blooming. When it's our birthday, holidays like Valentine's Day tomorrow, we get or give flowers. So most of us tend to have pretty positive associations with flowers for obvious reasons. And then we've got bugs. Needless to say, most of us have pretty negative associations with bugs. So a group out of Harvard took these associations that are pretty, again, universal, and put together something that allows us to actually test for associations. Okay. And we're going to take a couple of minutes. I think we can spare the time. We're going to take a couple of minutes to walk through this exercise. We won't take a whole lot, but you'll at least get an idea of how it works. So what you're going to do is you're going to do it in your head as you see it here on your screen, but I'll tell you what you're going to do in your head. You're going to work down this column here, okay? And if you're really quick, you can work down the second column after you finish. So what we're going to do is we're going to read a word, right? If that word is an insect or a pleasant word, we're going to make a mental slash in the left circle. If that word is a flower or an unpleasant word, we make a mental slash in the right circle. Again, if it's an insect or a pleasant word, slash on the left, flower, unpleasant, slash on the right. And you'll do it as quickly as you can in your heads, right? So go ahead, take a little time to do that, and then I'll yell at you here in a couple of minutes. Okay, I'll cut you short here, but I think you probably had enough time to understand the activity and get a sense of how easy or how hard it is for you, right? So that was side A. Now I'm going to show you side B, and it's a similar task, but the instructions are a little bit different. So listen closely. So this time, what you're going to do, if it is a flower or a pleasant word, you make a slash on the left circle. If it's an insect or an unpleasant word, you make a slash on the right. Flower or pleasant, slash on the left. Insect, unpleasant, slash on the right. Again, try to go as quickly as you can. Pay attention to if it's harder or easier than side A. Okay. So what are your thoughts? Did you notice a difference between the two sides? I know you didn't do the whole thing, but hopefully you had enough time to notice a difference. Some responses coming in. Second side was easier, much easier the second time. Right, yeah. And just to cut it short, 98% of the people who do this have a much easier time with side B. It stays pretty consistent. The only two times that someone has had an easier time with side A, I remember, and one was with our surgery residents, where a surgery resident said, hey, side A was much easier for me. It was a female resident. And she went on to say when she was a little girl, she was that little girl that would pull up her skirt, drop down in the dirt, look for bugs, and just have a blast. And then she went on to say that she never really has ever been into flowers that much, right? So it actually makes perfect sense as to why side A was easier for her, because she has positive association with bugs and marginal, at least, association with flowers, right? But the 98% of the rest of us are the other way around, right? And so these researchers realize, well, if you can test someone's association, this is kind of like a control, that you know what to expect, right? You can test someone's association about flowers and insects. You can do it probably about other things things with a little bit more social discomfort, if you will, right? So this became known as the first implicit association test, which I'm sure some of you are familiar. Some of you may not be. And this was all the way back in 1994, and it of course led to the creation of the second implicit association test and many others. The second being something in line with this. Instead of flowers and insects, we have the faces of little Black kids and the faces of little white kids. And the idea of that is uncomfortable for most, myself included, to do what we just did with insects and flowers with the faces of little children. Understandably uncomfortable, right? And this is what that would look like. And so if we are able to kind of jump into time to present day, 3.5 million people have taken this very implicit association test that I just showed you with the faces of the children. And of the 3.5 million people, 70%, much like the 98% with the flowers and insects, 70% had an easier time pairing the faces of white children with pleasant things and the faces of Black children with unpleasant things, okay? Including 10 to 15% of Blacks who took the test. Other tests have been done too. This test in regards to same-sex couples was done, and it was found that 65% exhibited negative bias against same-sex couples. The American Bariatric Society refers to weight bias as the last socially acceptable bias in our society. And so it might not surprise you, and not saying that it should be socially acceptable, but it is. And so it might not surprise you that 75% of people who took the implicit association test on weight had a negative bias against individuals with obesity. Gender and career. I think this is a very interesting one. They found that the implicit association test that looked at science and math career and gender, when a woman showed a bias that a science and math career was a man-oriented career, she was much less likely to major in math and science in college. And in countries where they saw a large man equals math science disparity, those countries also had larger achievement gaps in their children in math and science achievement tests. So the big question is, well, can we link these results on implicit association tests to discriminatory behavior? And for a while we didn't know, now we do. There've been a lot of studies that show that there's at least a moderate correlation between someone's results on an IIT and their likelihood to make biased decisions, okay? And if the IIT is actually able to record implicit bias, or measure it, I should say, this technology called functional MRI is actually able to image it as it's happening real time, even if the person who are having these thoughts and associations are completely unaware. It is an amazing technology. So what a functional MRI is much like an MRI that maybe some of you may have had if you had a bad shoulder, hurt your knee, or had a bad headache, except the regular MRI looks at the structure of an organ, right? The functional MRI looks at the organ's function. And it does this via recognizing increases in oxygen and increases in blood flow. And because we know that when a part of the brain is working, it needs more oxygen, it needs more blood. And we also know that what every part of the brain is responsible for, more or less, we can actually see what part of the brain is working most by using functional MRI technology. It's pretty crazy. So it was actually a perfect technology to study bias, because when you have a thought or an emotion, even if you're not actively aware of it, your brain is still producing that thought or that emotion, and it's gonna be sensed by functional MRI. So there are a few emotions that have been studied amongst many, but these are highlightable. Fear, disgust, empathy, we won't talk a whole bunch about that, and human recognition. So in one study, they took individuals, they put them in a functional MRI machine. They then exposed them to imagery that is generally thought of as being scary. Pictures of snakes, spiders, bears, tigers, things that humans generally respond to with fear. And then they looked at the amygdala, right? The side of the brain that's responsible for that fear response. And they saw on functional MRI that the amygdala activated as expected, right? They then took these same individuals and they exposed them to imagery just like this one you're seeing on your screen, pictures of young Black males. And they found that in some of these individuals, when they viewed pictures of young Black males, their amygdala lit up to a greater degree than it did when they were exposed to snakes, spiders, bears, and other scary things. And think about that in the context of officer-involved shootings, where an innate implicit fear of a young Black male may contribute to some of these terrible, terrible tragedies that take place far, far too often. In a similar study, they took individuals, put them in a functional MRI machine, and they exposed them to things that are generally thought to be disgusting to humans. The smell of rotten eggs, rotten garbage, and pictures that are kind of gross to look at. And they saw that the insula, the part of the brain responsible for being grossed out, lit up on functional MRI. And then they showed them pictures like this, very benign, displays of affection between same-sex couples. Embracing, hugging, kissing, holding hands, that sort of thing. And they found that in some of these individuals, especially individuals who had an IAT test result that showed a bias against same-sex couples, their insula lit up to a similar degree as it did when they were exposed to rotten garbage. And in the research, they referred to a group of individuals as extreme outgroup members. And in that category, they place individuals who suffer from homelessness, people who struggle with intravenous drug use. They put them in the category extreme outgroup members. And what they found is that, hey, when I look at, you all's pictures here, I'm seeing Garrett and Ben and Kenzie, the part of my brain that responds to humans is lighting up because I see another human, right? There's a part of the brain that activates when you see another human. They found that when we interact, members who are not in that extreme outgroup category, when we interact with people who are in that extreme outgroup category, the part of our brain that responds to seeing other humans responds much, much less. And you can imagine how that would dictate a physician maybe not being comfortable putting out a hand and comforting someone who may be homeless or has an intravenous drug use problem, right? You can see how that can impact how empathetic we may be for individuals who are in that category. So where do these biases come from? Quickly, some of it is just the product of us having to manage so much information at any given moment that we have to rely on pattern recognition and mental shortcuts, autopilot, basically. And it frees us up to do things that we need to have a conscious mind to do, right? It's so much information that there are going to be times where we just don't have enough information to make decisions, and we think we do, and that's where biased decisions come from. Another part is our past experiences. The people we've met in the past, the interactions we've had, right? And if they're tied to a strong emotion, we're going to remember it even more, right? Our brains are good at that. What our brains aren't good at is separating true lived experiences from experiences that we've gotten secondhand through media or TV or stories that other people have told us, right? It doesn't really make a difference. It still impacts our associations and stereotypes. And I'll just say that the media, whether it's news media, TV, movies, are big perpetrators of the association, stereotypes, and biases that we all have, okay? And then the whole question of how much of this are we born with, right? At some point, tens and tens of thousands of years ago, was there a survival benefit of being at least aware and maybe a little bit hypervigilant around someone who was of a different group? And the answer is absolutely it was, right? I mean, caveman A saw a member from clan B. Of course, they were going to be aware and hypervigilant and ready to fight or run from that individual, right? So there was there definitely is an evolutionary component of it. Fast forward to modern day time, that benefit has faded away, but we still may be left with some of those instincts. And there's a lot of research to show that babies as early as 4 or 5 months old discriminate against others for something as arbitrary as what kind of snack that other person likes, all right? So if you're interested, if you just YouTube implicit bias 60 minutes, you can see some of that research with the biased babies. It's phenomenal. So personal experience of bias, this, if we had more time, this is where we would kind of share some stories. I'm going to share two. One that is significant, one that's kind of funny, maybe not significant. but for the reason of saying not all of these biased thoughts that we have are damaging, right? But some are. And one that I would say is very damaging was when this was while I was a speaker on implicit bias. I was at the nurse's station, and a patient walked by, and he had a hospital gown on, had tattoos on his face, tattoos on his neck, tattoos down both arms. He was Black, and he was probably 20, 21 years old. And the first thought that came to my mind was, I wonder if he got shot. And as soon as I thought that, I was kind of internally embarrassed for that being the first thought that I had about this kid, young man. But I didn't just stop there with saying, oh, that's stupid, Jabraan. Obviously, it could be a lot more things other than that. But I wanted to figure out why that was my first thought. So I took some time to gain some insight as to what my associations were from this guy that made me think that. And I was left with the thought that I clearly had an association with someone with tattoos all over, who was young and Black, as someone who was around violence. Right? And I asked myself, well, what if the race was different? What would my thought have been? And I realized that my thought would have been, maybe is this person here for a drug overdose? Equally wrong and equally probably unlikely, but I was able to figure out some biases that I actually didn't even realize I had just by trying to do some self-reflection. And I think that is important for us all to do, to try to gain some insight as to what some of our biases may be that have kind of flown under our radar. The other story that I will tell you is this was around the same time, actually. I was about to do a presentation like this. It was in person. I needed a clicker for my PowerPoint, and so I was out of batteries. So I went to Walgreens, and it was like mid-afternoon. There was literally no one in there when I went to grab the batteries. I was walking to the front, and I saw this little old lady with her bag walking to the front as well. And I was late. I had like 4 minutes to get across the street from my presentation. So part of me was like, man, I can smoke this lady, get to the counter and beat her and get out the door, right? But my mom in the back of my head was, boy, you better. So I let her go first, right? As I should have. So she scooted on up to the counter. She put her stuff up there, and I'm looking at my watch because now I've got 3 minutes to get across the street. I'm clearly going to be late, right? And the cashier checks her out and gives her total. And the very first thought that came to my mind was, damn, I hope this lady doesn't write a check. And I literally cannot tell you the last time that I saw someone write a check at a grocery store, but I clearly have this association with old people and check writing, even though it's been 15 years since I've seen it happen, right? And if she would have pulled out her iWatch and tried to, use Apple Pay, like my head would have exploded, right? Because that's so far away from the association that I held for that lady, right? So sometimes these little thoughts we have are funny, and we can laugh about it. They're victimless crimes, right? But other times they may affect someone's life, right? And so it's important to acknowledge this ripple effect, right? And although implicit bias is different from explicit discrimination, the ripple effect is equally or maybe even more profound, because there's more implicit bias than there is explicit discrimination in our country and in our world, right? So what we're gonna do is in the next 8-9 minutes, we're gonna just talk about some places where we see bias heavily impact different sectors. So first being employment, right? The workplace. We know that people of color and women are at a profound disadvantage in the workplace. There was a study that showed that a white man who disclosed a criminal record on his resume was more likely to be called back for an interview than a Black man with no criminal record on a resume. We know that today in 2021, even, women make 80 cents on the dollar compared to men for doing the same jobs. And there's this narrative to write it off. Well, they take more time off. They stay home with kids. They're more likely to, be part-time. No, this is hour for hour. This is when you control for those factors, when it still makes significantly less than men for doing the same jobs. And although now in 2021, the workforce is 50-50 man, woman, women are at a huge disadvantage in being represented in manager and leadership positions. Look at the Fortune 500. There are 500 companies in the Fortune 500, which means there are 500 CEOs of those countries, or those companies. Of the 500, 33 are female. Only 33 are female. Yet, 24 of those CEOs are named Michael, 20 are named James, 18 named John, and 15 named David. Literally, any combination of 2 of these names is more than the total number of female CEOs in the Fortune 500. Crazy. So probably the only other area that has stakes as high as medicine is criminal justice. And we know a lot about the disadvantages that certain people have within that system. 40% of the American prison population is Black, while 14% of the American population is Black. And some of that has to do with social factors. A lot of it just has to do with unequal treatment within the criminal justice system. There's a 31% incarceration rate for drug offenses for Blacks. That is 19% for those same offenses for whites when you control for criminal background. Right? We know that Blacks and Hispanics are going to be more likely to be stopped and searched on traffic stops. We know that a Black man is 11 times more likely to receive the death penalty than a white man. And if the victim happened to be white, this number climbs closer to 20 times more likely. And if that Black person had more quote unquote Black features, darker skin, fuller nose, fuller lips, the likelihood of receiving the death penalty goes up even further. Right? This is all in the research. And we don't have to go far to see bias play out. This is in Tulsa. This is 15 minutes from where I'm sitting right now with Terrence Crutcher, who was an unarmed Black man who was killed. And this is a picture from the police helicopter where you can overhear the officer 100 feet in the air saying that looks like a bad dude from 100 feet in the air. Also commenting on how big Terrence Crutcher looked. Terrence Crutcher was an average sized guy, that was proven. But there is data to say that Black men are thought to be larger than they actually are. And so you can imagine how that, or more powerful, more scary, right? You can imagine how that contributes to some of these tragedies. Healthcare, right? This is my field. I see bias every day. I probably make biased decisions a lot more than I would like. And it's all over. We know that white men are more likely to be sent for potentially life-saving cardiac intervention than women or men of color. We know that obese women, despite spending more contact hours with healthcare, are less likely to be referred to for routine screenings. We know that physicians have been proven to be less likely to provide narcotics for Black adults or Black children. We know that physicians have been found less likely to treat a woman's pain with narcotics than they are men. We know that women are less likely to be referred for joint replacement surgeries than men. And when they are finally referred, they're older and their disease is more profound than when men are referred. Black and Hispanic children are less likely to be diagnosed and treated for ADHD, yet more likely to be diagnosed with behavioral problems. And you can imagine how that stigma hangs onto them like the scarlet letter as they try to matriculate through their education process. Native American women, Black women, 2 and 3 times more likely to suffer from pregnancy-related deaths. Institute of Medicine did a sweeping review of all this stuff. They found that there's disparities in every area when looking at race. They found minorities receive fewer screenings, less surgical referrals, less initiation on dialysis, fewer organ transplants, but are more likely to receive amputations when limb-sparing treatments were more appropriate. So all of this is it's a lot, right? It's sobering to kind of go through this information, right? The good thing is that there are some things that we know are helpful. And again, as we wrap up, I'm just going to briefly go through some of these things that are known to be helpful. First thing is separating implicit bias from the feelings of guilt and shame and badness, right? Destigmatizing what it means to have implicit bias. We all have it. Doesn't mean we're bad people. We shouldn't feel bad about it. And we've got to bring down those barriers because if someone feels shamed, guilty about something, they're not going to face it, right? So we need to really destigmatize what it means to have bias. That's an important first step. Recognition and acknowledgement, right? Acknowledging that we all have it, and then taking time to recognize what some of your biases may be. And that requires introspection, right? You have to gain that insight to be able to do that. Exploring awkwardness and discomfort. That means just asking yourself, why do I feel uncomfortable around that person or that group of people, right? Try to notice, are there people that you just kind of trend away from, or a certain person that makes you feel awkward, right, or uncomfortable? Is it because dude is just awkward? Maybe, right? But it also may be because he reminds you of someone that you've met in the past, right? Or simply a character that you knew from a movie or a TV show that you didn't like. So there are answers there often, and you just need to make sure you feel uncomfortable around someone for the right reason. Considering the opposite, especially when making important decisions, hiring, firing decisions, treatment decisions, decision not to treat, just take some time to consider the opposite and making sure that bias hasn't contributed to that decision. Most of the time you'll find that, no, this is a solid decision. I'm ready to move forward with it. But I guarantee there will be times where you say, wait a minute, I don't have enough information to make that decision, right? You take a step back. Exposures to exemplars, counter to stereotypes. These are being around good people from all different backgrounds. That's what it means. In a study, they took people who had implicit association tests that showed bias against Blacks. Then they exposed them in the study to everything positive in Black, right? Like, Barack Obama speeches, Denzel Washington movies. At the time, it was Bill Cosby. That didn't age well. We're going to kind of write that out. But what they found is through exposure of these exemplars from the Black, culture, they actually saw their IAT results improve, which is phenomenal. It was transient because obviously, months later when they didn't have this continued exposure, but that speaks to being around great people from all different backgrounds, right? Blinding decision processes when able, right? Specifically with hiring, asking yourself at what point in the process do you need to know someone's race, gender, or age? Do you need to know it from the very, very beginning? Maybe you do, but maybe you don't. And if you don't, you should hold off until you do need to know that stuff, right? Because we know all of that information impacts who's going to be offered an interview or even a job. Reviewing undesired outcomes. This is specific to medicine, I think. Like if we have a death or a bad outcome, we always review the medical care, but we should also look at it from a lens of trying to find bias. Did bias on the part of the care team contribute to this bad outcome in any way? And just simply asking those questions could be helpful. The use case for diversity inclusion has never been better. And it's not just because it's the right thing to do, but we know that diverse organizations are better organizations. They make better decisions, they make more money, they retain their employees better. So there's a business case for it as well. And so, I'll leave it at that, but there is an important reason for this stuff. And then finally, if we're able to do 1 through 8, this leaves us with number 9 being easy to do. We all know that it's not, but this is what we're trying to do, right? We're trying to interact and make decisions about someone based on them as the individual they are, not someone who is part of a smaller or larger group. And that's hard to do, right? And it takes a lot of work, and it takes a lot of insight to our own biases and our own thoughts and ideas for us to be able to do that. It's not easy, and you're going to fail at it. You're going to fail again, but you're going to get better, right? And ultimately, I think we have some room to improve here. So with that, all done, 3:30 on the dot. This is a book that I would recommend for everyone, Blind Spot. This is literally the whole reason I do this work, because I was so compelled by this book. It's such an easy read. These two individuals were at Harvard and are the contributors for the implicit association test, but they wrote a really great book on implicit bias, and it does a good job of destigmatizing what it means to have implicit bias. Everyday bias has a little bit more in terms of like some of the really cool studies that have been done. I thought it was really interesting, but if you're going to read one, read this one on the left. And I recommend you all take some time to take implicit association tests, and you can do that at implicit.harvard.edu. So with that, I am going to turn it back over to Rachel.
All right, we've got about 5 minutes before they close the breakout room. Does anybody have any questions they want to ask? Never mind, I just saw the message on